Welcome, Symone. We're so happy you could be here with us.
I'm happy
And
to be here.
oh, well, that's great to hear. And if you don't mind, we'd love for you to just introduce yourself, where you're from, where you served, and what you're doing now.
Sure. So my name is Simone. I grew up mostly in Arizona, but kind of moved around a bit. I ended up going to Amherst College in Massachusetts for my undergrad and studied biology. And it was after my undergrad degree that I decided I wanted to do a service year and kind of stumbled across Mercy Volunteer Corps. So I ended up serving in Philadelphia at the Mary Howard Health Center, which was a community health center that served mostly patients experiencing homelessness. And so I was able to kind of work in the healthcare setting there. And I had kind of known I wanted to go into nursing. And so that led me to applying to nursing school. So after my service year, which was in 2016 to 2017, I went to Yale and did their nursing program that led straight to a nurse practitioner degree. And now I've been working in Louisville, Kentucky as a women's health nurse practitioner for the past couple of years. And I'm also at a community health center here in Kentucky.
Wow, that's amazing. Such varied experience
Yeah.
and a lot of experience and expertise in such a little time.
Yeah, things kind of fell into place.
That's great. That's great. And Simone, as you were considering a year of service, what were your hopes? What were you expecting? And how did you decide which program and service site were right for you?
So I had been involved in service both in high school and then in college. So I kind of always had it as an option for after I graduated. And I ended up going into my undergrad thinking I wanted to go to medical school and was pre-med, then thought I wanted to do public health. Ultimately, I knew that I wanted to do something that involved working with the community and promoting health. And so I thought doing a service year program would kind of be the best way to explore some of the different options that fell into that kind of broader sphere. So I looked into several different programs. And I don't remember exactly how I found out about Mercy Volunteer Corps, but somehow I did and ended up having a great interview with one of the leaders in the program who was able to tell me more about the different sites. And for me, I specifically was drawn to Mercy Volunteer Corps because they had healthcare placements that seemed to really have patient interaction and also interaction with healthcare providers. And also the community living aspect of it was something that really drew me to Mercy Volunteer Corps. And so I eventually was told about the site at Mary Howard Health Center, which is a health center that's managed by nurse practitioners. And so knowing that I wanted to go into nursing school, it ended up being really a great fit for me to be able to make those kind of personal and professional connections. And I actually ended up writing a lot about my experiences at Mary Howard Health Center and my applications for nursing school. And even now, relying on some of those experiences and skills in my work even now.
That's incredible. Yeah, we even have a good number of volunteers this year who are thinking about nursing school, med school, and it sounds like you were still able to manage your service site community and even doing applications too.
Yes, so I was. There were weeks where it was a bit busier with, kind of going to the service site every day and trying to stay involved in the community. But overall, I really found that it was a great kind of stepping stone before going back to school for healthcare. Really just having that on the ground experience in a healthcare site, I thought was really great before going back to school. So it worked out
That-
well for me.
That's great and wonderful hands-on experience too.
Yes, for sure.
That's great. So I'm curious to hear more about your role at the service site at the health center, and what did you learn about compassionate service and what compassionate service means to you?
Okay, so my role, I believe my exact title was a patient care advocate. Mostly what I was doing was working with patients who may need a little extra assistance getting connected to social services or just kind of more follow up in their care. One of my favorite parts of the role was I would go with some patients to their specialist appointments and kind of act as their advocate while they saw their specialist, make sure they were heard, able to kind of ask important questions. And then I was able to bring that information back to whoever their provider, their primary care provider was at Mary Howard Health Center. So it really was a unique opportunity. I would sometimes go and meet patients wherever they were at, whether it was in a shelter or at their home, travel with them to their appointment, kind of sit in the waiting room with them, go and see the doctor with them. So it was a great way to kind of build relationships with patients and also see different sides of the healthcare system. So that was definitely something I enjoyed. I also worked on just kind of quality improvement projects. So did some tracking for which patients were overdue for certain cancer screenings, like breast cancer, colon cancer, and cervical cancer screenings, and coming up with spreadsheets so if they were coming in that day, making sure they could get scheduled for those appointments. But I do feel overall the role did kind of change over time, depending on what the health center needed. So I definitely also learned just to kind of be flexible and adaptable and go with the flow. But I think my favorite parts of it were having opportunities to educate the patients as well and just do kind of some basic teaching, nutrition teaching, medication, reconciliation. So it kind of was a unique experience, I'll say, and every day was definitely different.
It sounds it. And yeah, such inspirational work too. And I'm sure you helped a lot of people. Yeah. And what has been life-giving in your work, Symone? In what ways has your experience, challenged you to grow and change?
I think similar to talking about my role at Mary Howard Health Center, I really think I find just connecting with people one on one where they're at to be the most life giving part of my work. Part of the reason I wanted to go into more of a primary care setting was to build longer term relationships with patients over time. So I find it very rewarding to see patients be able to come back and kind of follow up, see how things are going, see if things are better. So that's definitely something that I find life giving, or being able to even share knowledge kind of both ways. Definitely working in a lower resource setting, there's a lot of gaps in healthcare knowledge. So it can be very fulfilling to just provide this information that can be life changing for someone. And also, it's just a very multicultural area. So, on the same token, I can learn different things about different cultures and different backgrounds from my patients as well. So, both of those make it very rewarding. Um, I think it's definitely challenging working in the setting as well, though, where just patients are facing a lot of hardships and
Mm,
injustice. And so, kind of seeing that every day and having a limited role that I can play to improve can be challenging at times. But I think it's just led me to focus more on the positive impact that I can make and also work on being able to connect patients to other colleagues in different specialties, whether it's mental health or social services, to kind of help with those things that are beyond my current scope and role.
mm,
Um,
wow. Yeah, keep going, please.
so yeah, I think overall with it's caused me to just be more adaptable and flexible and open-minded. Um, just because similar to my work at Mary Howard and my work now, it's still every day is different. There's still challenges both within the organization, outside of the organization. Um, so yeah, I think overall, it just kind of has made me more empathetic and open-minded.
Mm, that's amazing. Such great life lessons too. Wow. So Symone, for people watching this Q&A, for those discerning, should I do MVC? Should I do a year of service? What would you say to folks watching? Why? Why should someone serve with MVC? What advice do you have for someone discerning a year of service?
Right. I definitely think it's a very unique opportunity for both professional, personal, and spiritual growth, which is what drew me to MVC compared to some of the other programs that I looked at that maybe didn't have as strong of a community component or focus on spirituality. Um, I think it's definitely for someone who's prepared to step out of their comfort zone and definitely be challenged, maybe both at in the community life and at their service site. But overall, I think it's kind of a great opportunity to step outside of yourself for a year. Um, I really enjoyed being able to live in a city I had never lived in before and get to kind of know the community through my coworkers at the service site and even through hearing about my community members' service sites and getting to interact with people there as well.
Mm,
I also felt like I really enjoyed the support from the MVC team. Um, and I felt like at each service site and in our cities, we had someone we could go to if we were having any challenges or difficulties, which coming straight kind of out of undergrad, I felt like it was a nice transition for me into more actual adulthood. Um, so that was something I also enjoyed. But I think someone interested in it, it definitely is a big decision as it is a whole year commitment. And so I think it's just important to think about long-term goals, both with service, professional goals, personal goals, um, and to think about the different ways that a year of service could be found challenging, whether it's being away from family, um, if there's any unorganization at the service site, just interacting with different personalities. But overall, I feel it's just a great experience to challenge and learn more about yourself.
that's amazing. Yeah, all of it. We're so grateful for your time. You mentioned community life. I just want to end with one spontaneous question. What if you think of a memory or a moment that sparked joy for you um, at some point in your community, living situation throughout your time? Um, what might that be? Or something fun you did together?
Yeah, there's actually quite a few. My community, we did make a lot of effort to try to do things together and try new things. We ended up joining a kickball team. And so I won't say we all stayed committed the entire time, but at least at the beginning, it was kind of fun. None of us knew how to play kickball or had like been on a team before. So just all doing it together, trying something new, was definitely a fun memory.
That's great. I love it. Oh my gosh, Symone, thank you so much for sharing some of your story with us and your light and inspiration. And thanks to everyone who watched. And we're currently accepting applications for service beginning in August 2023. And applications are accepted through our website, mercyvolunteers.org, on a rolling basis. And if you have any questions at any time or would like to talk to a Mercy volunteer, please reach out to us. You can email us at recruitment@mercyvolunteers.org or visit our website, mercyvolunteers.org. Thank you so much again, Symone, and have a great night.